I would definitely say that the psychological effects of primary bone cancer remission have the biggest impact on my life at the moment and always have done.
I got a little bit anxious about it. I was concerned about finishing the treatment. Would everything still be okay? And eventually that led to depression. Not what I was expecting, having gone through 2 years of chemotherapy. But I went to see the doctor about it, and the doctor suggested antidepressants. I rejected that and decided something had to be done about it. And I think what it was, I was looking back on things I used to be able to do.
I suffered my first panic attack when I was in hospital. I saw a psychologist who spoke to me about fight or flight and made me understand why my body was having this reaction. It was around food. Food was a big thing for me at the time. I was very nauseous, and if I wasn't feeling nauseous, I was suffering with mouth ulcers that made eating painful. But I knew I had to keep my weight up to be able to have the chemotherapy. So it was a very difficult balance, and when the food trolley used to come round on the ward, that used to set off my anxiety, and I ended up having a panic attack and thinking that I was going to faint, which is a bit of a fear of mine. Since then, I don't have panic attacks regularly. I will have them now and again, but my anxiety is something that I do deal with on an almost daily basis. I had counselling, not for my own cancer, but my father passed away 5 years after I had been diagnosed. My father passed away from cancer, and I had counselling in university to deal with that. And I spent about one session talking about my dad and the grief that I was going through and the anxiety that brought up. And I spent a lot of other sessions talking about the trauma that I'd suffered from my own cancer experience, which had then been brought back up watching my dad go through it. So I think I didn't realise the true psychological impact until I was forced into a situation, I guess, where I had to confront it. And yeah, I think it had a bigger impact on me than I actually realised.
One big part of this is having health anxiety, which I wasn't too sure I had until a few years ago. I thought it was quite normal, I suppose, for me to think that anything I had wrong, a cold, a high temperature, a pain of any description, was going to be cancer. I think this is particularly prevalent with primary bone cancer, where there's so much misdiagnosis. I know for me, my mum took me to the GP, I think it was 7 different times through about a 6-month period before I was referred for an x-ray, and then I went on to be diagnosed, and each time we went to the GP we were told it was growing pains in my leg, where the tumour was in my femur. Yeah, told it was growing pains a few times, or potentially fluid on the knee. So that has also led to a sort of mistrust, I suppose, I have when I go to the GP for something that's bothering me, and they reassure me that everything is okay. Even then, I don't particularly believe them. I know I should believe them and trust them, they are very well trained, but after misdiagnosis, that's a really hard thing to build back up. And especially I've had a few instances at the GP. For example, when I went to uni, I found a lump on my breast that I was really concerned about, and when I saw the nurse, they said that it was nothing to worry about because people as young as me wouldn't get cancer. And it turns out they did not have my notes from when I moved from home to university, so I had to explain that I had already had it. So circumstances like that and experiences like that really add to it.
Health anxiety is something that I do suffer with. Any ache or pain, I instantly assume it's cancer, or something similar, but mainly cancer. I do kind of suffer with that. Honestly, it's one of those things that keeps me up about, like, you know, when you're awake at 3 o'clock in the morning and you're on your phone scrolling through the internet looking for answers. It's one of those sort of worries. On a day-to-day basis, I don't think it affects me so much, but as soon as I start to feel a bit of pain anywhere or anything like that, my mind instantly goes to cancer.
And another element of that, I suppose, is that I really don't want to waste any NHS resources. It's very much in the news, especially following COVID, about how much we cost the NHS with different things. So I don't want to take up time from someone that might have a much worse problem. I know there's a lot of waiting times for certain clinics and RGP for sure. So I don't want to take someone's time, but also if I'm really worried about something, then I do find myself going. So it's a bit of a toxic cycle, I suppose. Going to the GP to get it checked out, not even really believing the diagnosis or the outcome, and then still being worried about a symptom, but not wanting to make another appointment to waste funds. So yes, that is something I'm still currently working through.
I had by now pretty much returned to a normal life, although there were still sort of associations that would remind me of having chemo. And in fact, one strange thing, the newsagents WH Smith, which some of you will know, they had a store in Nottingham. I couldn't go in there because as soon as I opened the door, there used to be a restaurant upstairs, and the smell coming down from the restaurant reminded me of the chemo suite when I had all my treatment, and that would make me feel quite sick, so I never went in there. Sometimes there's an advert on TV. I think Cancer Research have been doing some adverts on television for fundraising, and you'll see an illustration of somebody undergoing chemotherapy. I can't look at that. It just makes me feel nauseous.
I still associate certain sounds and smells with the hospital. I went into the cardiology unit the other day just for a checkup, and even the smell of the hand wash just takes me back. The smell of the sick bowls, the smell of disinfectants, it all kind of just takes me back to being in hospital and being in that moment. And even the sounds, so when I used to be on the IV drip and it used to run out fluid, it would make that do 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 do. And whenever I hear a sound similar, it just instantly takes me back. I think my brain has blocked out a lot of what happened because I just have never really processed it. But those little things just take me back instantly.
During COVID, the smell of hand sanitizer really took me back to being in isolation wards and being neutropenic, and there was a lot of like similarities there, which I found quite hard to deal with.
So back to some sort of normal life. I changed industries. I was still a sales engineer. I was really enjoying my job. I was travelling throughout Scotland and Ireland and Northern England, leading a fantastic life. Obviously, I'd given up flying, but I was back in a band, playing drums, still cycling, still swimming, and yeah, really enjoying life. And believe me, I do appreciate how lucky I've been compared to others, but because of that, I do have a bit of a survivor's guilt, I think they call it. That's something, yeah, I'll have to live with.
I know that a theme that came up when I had counselling when I was 16 was actually that I was grieving my pre-cancer self, which I think is quite relatable to a lot of people that have been diagnosed with cancer. You grieve your previous life. And a lot of people that have been through any sort of trauma, or even great things like having a child, you might grieve your pre-child life. And to me, definitely my pre-cancer life symbolised my childhood, because it is very true that you have to grow up almost immediately. I went from being, I suppose, a little bit excited maybe that I was missing a day of school to have a biopsy. I didn't really understand what that was, and then all of a sudden having to face chemotherapy and different choices, having to take all this medicine, and knowing that I was having a large surgery, knowing that this chemotherapy would make all my hair fall out, and having to have those really adult conversations. So yeah, my pre-cancer 8 years of life was my childhood, I suppose, and then it was all very different. So I really struggled with grief of myself, which, as soon as I understood that when I was 16, I think knowing that earlier would have made those 8 years a lot easier, and I would have had a lot more compassion for myself, because I just didn't understand why I was feeling so hopeless and just wanting to go back to how it was. That is very much a stage of grief that I don't know if anyone ever gets out of, just wishing they were back. I know I spent a lot of time as a teenager, and this is quite sad, that the only way that I could get to sleep was just imagining myself as not having cancer and what my life would be like, and having 2 normal legs and being able to do the things I couldn't do. And I would just imagine and imagine and imagine that, and hope that I would wake up as someone else. And I think that is definitely a stage of grief, just like dreaming and hoping that they will come back, when of course they can't, which gets easier as time goes on. But I think definitely understanding it was a big part of me moving on from that, I suppose, once I understood and could name what it was, and got over the thought of, how am I grieving myself if I'm still here and I didn't die, and so many people do die. How audacious is it for me to grieve myself when I'm here, and my actually long-term outcome is really great. But yeah, that was definitely a bit of a breakthrough that I had that was really useful in navigating my feelings moving forward.
I do feel a fear of recurrence, as I've mentioned, with the health anxiety. I do worry. I did worry when I was younger. I think as I become older and become more aware of my health, I probably worry more about the cancer coming back in some form. One thing that kind of stays with me is that when I had the chemo before, I was young and fit, and now I'm that much older and my body's already been affected by chemo, my heart's been damaged. So would I be able to actually go through chemo again? I don't know.
Another thing that I find with primary bone cancer remission is that I have a really intense fear of reoccurrence. So I know I've mentioned that I have health anxiety, and a lot of that is completely centred around the fear of cancer coming back. I know from going to the bone cancer conferences and seeing the research out there, that secondary cancers are unfortunately really common, with Ewing's sarcoma, and especially sort of the age that I had it as well. So with that knowledge, I think I'm really afraid of cancer coming back. Like I mentioned earlier, when I had a swollen armpit from a COVID jab, I immediately thought I had lymphoma or leukemia. Any sort of check that I would do like on my breasts or anything like that when there was a lump that just turned out to be just tissue. I immediately thought I had breast cancer, even a headache, I'll think I have a brain tumour, or a cough that lasts for a little bit longer, I'll think it's lung cancer. Anything, any physical symptom I have, I immediately think I have cancer again, and immediately in my head go through the timeline of what would happen now that I'm an adult. Like what would I do with work? What would I do with looking after our cat? All of those things I immediately think about, the practicality of it and how I would get through it and would I get through it. And that's before even calling the GP, or the symptom going away the next day. I think about all of those things, and whether I want to or not, I won't be able to focus at work or at home on anything. I'll just have a lot of intrusive thoughts about how will I cope emotionally and financially, because I'm sure I have cancer again, which is again quite hard to deal with. But I'm sure I've got a lot better at negotiating that and try to practice separating myself from my thoughts as if I'm looking in from another perspective, which I found really helpful.